Hello guys, welcome to my channel. Today I'm going to talk about irritable bowel syndrome. I'm going to explain the symptoms, the triggers, and natural relief backed by real science. Hi, I'm Dr.RAYLEE, and good morning to you, good afternoon, good evening, wherever you find yourself. So we are talking about IBS or irritable bowel syndrome, and I'm sure you have heard of this gut condition or disorder before. This is the reason why I'm streaming, coming all the way from my room to you. So if you know your stomach controls your life, you plan your day around your bad news. If certain foods make you afraid to eat, you might not have a weak stomach. You might have IBS, and that is irritable bowel syndrome. And millions of people suffer silently without understanding what actually is happening inside their gut. So today I am breaking down what IBS really is, the real root causes of IBS, how it is diagnosed, the four types doctors recognize, and the biggest hidden triggers of irritable bowel syndrome, and also why your gut reacts to certain foods and the natural strategies that research shows can calm the gut. I would also explain the difference between irritable bowel syndrome and inflammatory bowel disease or IBD. And so stay with me because near the end, I will show you foods and supplements that many IBS patients say change their lives forever. Now, let's begin with our topic of the day. It's about irritable bowel syndrome. Now, what if I told you that your IBS might not really actually be a real problem? What if that bloating you're experiencing, the constipation you're having so often, that diarrhea, and the stomach pain you've been struggling with is just a symptom of something deeper going on in your gut? Will you believe me? This is why you are watching this video. Okay, because here's the truth, most people are treating IBS completely wrong. And if you have been dealing with IBS, like the bloating, the irregular bowel movement, unexplained gut issues, this video could change your life forever. Once again, if you are joining me, welcome to my channel. Drop a comment below your experiences, anything you know about IBS so that we can learn together. I would really appreciate it. Let's get started with what IBS really is. IBS is one of the most common digestive disorders in the world. And according to the American College of Gastroenterology, IBS affects roughly 10 to 15% of adults worldwide, and women are diagnosed nearly twice as often as men. And this is absolutely true. Now, my first personal experience with a patient with IBS was actually a woman around the age of 34 years, and that was way back in 2018. Since then, all patients that I have seen are all women with IBS. I have personally not encountered a male who had IBS. So it is true that nearly women have twice as much of IBS than men. And this is very interesting. So I want to know why that is so, that IBS affects more women than men. If you know the answer, please drop them in the comment section below. I'll really appreciate it. Now, so it affects millions of people globally, yet it's one of the most misunderstood conditions. And that is why this video will clear all your doubts, all your fears, and all your misunderstandings. Now, here's why. You see, IBS is what we call a functional disorder, meaning that no clear damage show up when you do a scan. So when you take an abdominal scan, for example, you don't see any damage whatsoever because it is a functional disorder, meaning that the functions of the gut are not working properly, but there's no damage to the tissues or the organs in your body, and that is why it is called a functional disorder. And then also the colon, becomes overly sensitive, and normal digestion feels painful, and so they are not behaving properly. That is, your gut is not behaving properly, even though there's no visible damage anywhere with the scan. And so gas, when built up, feels like pressure, and the pressure feels like cramping, and the food either moves too fast, causing diarrhea, or moves too slow, causing constipation. So people with IBS might experience either diarrhea, abdominal pains, constipation, or even both diarrhea and then constipation every so often. And because of this, there is no definitive lab test to confirm if someone has IBS. And so we rely on symptoms and signs to diagnose you if you have IBS. And that is why doctors diagnose IBS using something we call Rome IV criteria. And that means number one, there must be an abdominal pain at least a day per week for 3 months. Okay, so the key symptom that one doctor or doctors will look for is recurrent abdominal pain tied to bulging. Without abdominal pain, it is not IBS. Okay, and so and then aside abdominal pain or in addition to abdominal pain, then you should have at least two of these. That is number one, pain related to bowel movements and changes in your stool frequency and changes in your stool appearance, which lead to things like bloating, diarrhea, constipation, alternating bowel habits, mucus in stool, nausea, and urgency after eating. So the cardinal sign right here is recurrent abdominal pain at least once a day per week for the last 3 months, together with any of the symptoms like changes in stool frequency, changes in stool appearance, and then other related conditions. Now, if these aren't present, that is abdominal pain, you don't see any changes in stool appearance or frequency or movements, you look for other conditions. And that is why IBS is actually a diagnosis of exclusion, meaning that doctors must rule out other conditions that mimic the same symptoms and signs of IBS. So things like Crohn's disease, ulcerative colitis, celiac disease, infections, lactose intolerance, colon cancer, these also have almost the same symptoms and signs of IBS. And so there must be a definite or proper evaluation. It really matters to come up with a definite that whether the person has IBS or the other conditions that I just mentioned. So never self-diagnose persistent gut pain, because the gut pain is a cardinal sign of IBS. And if there's no pain, then please look into something else. It might not be IBS, as we've stated so far. Then we're going to talk about why IBS affects the mind. Okay, and here's what people don't really talk about enough. You see, irritable bowel syndrome, affects mental health. And so research shows strong link between IBS and anxiety, depression, and stress sensitivity. Because the gut and the brain are directly connected. They are always having a communication. Your gut and the brain are always communicating with one another. So once there's an issue in the brain, it affects the gut. When there's an issue with the gut, it also affects the brain. They are always in that constant communication. And so that is why it is called the gut brain axis. Your intestine literally talk to your nervous system all the time. Okay, so one of the symptoms that usually, or the cardinal signs of IBS will be sometimes mental issues. Okay, I'm gonna get that as soon as possible. And you see, not all IBS is the same, and this is where most people get confused, because there are 4 types of IBS. IBS is categorized into 4 categories, and the first one we call IBS-D. The D stands for diarrhea. That means diarrhea is dominant. In addition to the abdominal pain, you might experience a lot of diarrhea. So we say IBS-D. The second category is called IBS-C, and that is constipation. So you might have pain, some changes in your bowel movements, and then the dominant bowel frequency movement is constipation. The third category will be IBS-M, which means that a mixture of diarrhea and constipation. And the last one is IBS-U, that is unclassified. That, in other words, we can't really classify that as diarrhea dominant, constipation dominant, or even a mixture of diarrhea and constipation. So these are the 4 categories or 4 types of IBS that most people have. You could fall into any of them if you have IBS. Okay, so knowing your type helps guide treatment, and therefore each type has different triggers and treatment approaches. For example, let's say your IBS, the dominant bowel movement or frequency is diarrhea, which means you have fast gut movement. Another person might have constipation, which means the person has slow gut movement. And so treating them the same is a big mistake. Okay, so though we might all classify you as having IBS, treatment and management is individualized depending on the category you fall under, whether it's IBS-C, IBS-D, IBS-U, or IBS-M. Okay, and now we're going to talk about why IBS happens. We've talked about what IBS is, the cardinal signs, the types, and now we want to know the root causes of irritable bowel syndrome. And here's where things get very interesting. You see, IBS isn't just random. It is usually caused by underlying imbalances. And therefore, there is no single cause of irritable bowel syndrome. But research points to several overlapping factors or root causes. We're going to get into right that. And so fixing these root causes will dramatically help you manage your IBS or reverse it in many cases, as I have with a lot of my patients. So the number one factor will be what we call the gut-brain connection. I told you the gut and your brain are always in constant communication. And that is why this is the first root cause. Once you deal with your nervous system, it really has great impact or negative impact on your gut as well. So when there is what we call nervous system dysregulation, things like stress changes how the gut contracts or relaxes. And that is why emotional stress can trigger flare-ups. So things like stress, anxiety, or trauma can increase what we call gut sensitivity and disrupt your digestion and trigger pain. And that is why IBS is strongly linked to anxiety, depression, and chronic stress. So if you find yourself under any of this, you are depressed, you are always anxious, you are stressed out, these can trigger or cause you to have IBS. Or if you haven't already, then look into your life. Are there things that is making you depressed, stressed out, or even anxious? They are contributing to making your symptoms worse, and you need to deal with it immediately. The second factor will be visceral hypersensitivity, or what you will call gut sensitivity. You see, IBS intestine overreact to stretching and gas, and even normal digestion could feel painful. This means your gut is overreacting to normal digestion, and we don't know why it happens. Sometimes we have what we call idiopathic causes. All of a sudden, your gut just reacts. So we say it can be an intolerance or even an allergy, and that can also trigger IBS. And so even small amounts of gas, food, stretching can feel like an intense pain. So that is the second factor that contributes to the development of irritable bowel syndrome. The first one is the gut-brain connection. Number two will be visceral hypersensitivity. The third one should be gut motility problems. And here, your intestines may move too fast, causing diarrhea, or move too slow, causing constipation, or fluctuate between both. So maybe let's say you are lactose intolerant. For example, you take things that your body doesn't like. Definitely, you might have diarrhea. Or let's say, you are taking things that will make you constipate a lot. You take a lot of flour food. That can also cause constipation and also trigger IBS. So there are things maybe you are doing in your life that is triggering constipation, and that will present with pain, or diarrhea that will present with pain. It can even be sometimes even certain foods as well. So please look into your life and see if there's anything that is increasing your gut movement or slowing down your gut movement. Okay. The fourth one should be gut microbiome imbalance. This is super important, and I want you to pay attention to this. You see, studies published in journals like the National Institute of Health show that many IBS patients have what we call altered gut bacteria, which affects inflammation, digestion, and mood. You see, your gut has a lot of microbiome things, especially in the colon. And so when there's anything that disbalances or causes imbalance of this gut microbiome or this environment, then it affects your digestion. It causes inflammation and mood swings. And then it goes off, and then it can trigger this IBS we are talking about. So because your body, you see, your gut is home to trillions of bacteria. And so when there is a balance of, or when that balance is off, problems begin, and this includes excess gas production, bloating, and inflammation. So things that could make you have an imbalanced gut microbiome, please look at that. And one of them will be the abuse of antibiotics. The fifth on my list will be SIBO, called small intestinal bacterial overgrowth. This is huge. Now, up to 70% of IBS cases may be linked to SIBO, that is small intestinal bacterial overgrowth. what is happening? You see, bacteria grow in the wrong place, that is the small intestine, when they're supposed to grow in the large intestine. So you have people who have an overgrowth of bacteria in the large instead of the small intestine. And that's what we call small intestinal bacterial overgrowth. And so when you eat, because of this overgrowth in the small intestine, when the food gets into the small intestine, they ferment the food and it produces gas, and the gas leads to bloating, and the result is pain, food intolerance, and irregular bowel habits. So if in your life you are doing things that is causing what is causing SIBO, or what we call small intestinal bacterial overgrowth, please be mindful of. Sometimes it can even happen as well, and that could be maybe as a reason of you having low stomach acidity, or some deficiency in certain stomach enzymes can also trigger small intestinal bacterial overgrowth. The state of malaria should be food sensitivities, or what we call food intolerance. You see, certain carbohydrates ferment rapidly and produces gas, and overwhelms a sensitive colon, or leads to an overwhelming sensitive colon. And so common triggers of food sensitivity or food intolerance should be the gluten, diarrhea, high carb diet foods, and many people don't even realize what they are reacting to. And we will talk about some of the foods that trigger IBS very soon. The last on my list would be post-infection IBS. That is, it can happen after food poisoning or gastroenteritis. That's a bacterial infection of your gut. Okay, and so even after treatment, your gut never fully reset. Okay, so if you've been poisoned, or you took a poison food, or a spoiled food, that could also trigger or lead to what we call irritable bowel syndrome. Now let's talk about the most important things, and that would be the triggers of IBS. Okay, where people have control over. So having talked about the symptoms, the diagnosis, the categories, and the factors or the root causes, now let's look at the hidden triggers of irritable bowel syndrome. We will start with the food, because this is where you can take control over. You have control over what you put in your mouth. Okay? And here's where most people, finally understand their symptoms, because you can identify what food is actually triggering your symptoms of IBS. So we look at what to eat and what to avoid. Now let's start with what to avoid. The first one, or the most important one to avoid, would be what we call FODMAP. That is FODMAP. FODMAP foods. Now these are what we call the fermentable carbohydrates that bacteria digest rapidly and produce gas. Okay, and then the F stands for, that is FODMAP, FODMAP. The F stands for fermentable gut bacteria digested carbohydrate. The O stands for oligosaccharides. So that would be things like grains, garlic, onion, and legume. And the D in FODMAP stands for disaccharides. So that would be things like the sugars. Okay, and the monosaccharides stand for one sugar, and then we have the polyols. So things will be sorbitol, mannitol, carbohydrate, and then fiber foods. Okay, now the opposite will be what you could do to help reverse or stop this FODMAP from entering your body, and that is why the low FODMAP diet was developed by researchers at Monash University and has strong clinical evidence for reducing IBS symptoms. So now let's look at foods high in FODMAP that you should avoid in total. So things should be like the onions, the garlics, the gluten in the wheat, the dairies, the beans, the legumes, the apples, the artificial sweetness, the caffeine, the spicy foods, and then surprisingly we have smoothies, probably because of the fruit sugar, and then even salads, because salads are very hard to digest due to the raw fiber and then even certain nuts. So these are food that you need to pay attention to if you have IBS. Okay, if you have IBS, the things I just mentioned, please stay away from them immediately. It's called FODMAP, and again, it stands for fermentable oligosaccharides, disaccharides, and monosaccharides, and then polyols. Okay, now what happens is that when you consume these FODMAP foods, they stretch your colon. And you see, IBS colons are very hypersensitive. And so what they do, they will pull water into their guts. They get fermented by the bacteria and produce gas. And this gas leads to bloating, pain, diarrhea, constipation, or any other symptoms we just mentioned earlier on. The second trigger, aside food, will be stress. Remember we said the gut and the brain, are always in constant communication. So you see, IBS is one of the clearest examples of the mind affecting the body. So stress hormones changes gut motility and causes inflammation. And so reducing stress is not an option, it's actually a treatment. So if you are under any stress or things are triggering your stress responses, please look at your life. Are there people, circumstances, things that is causing you to be stressed out? If so, then that could make your symptoms worse or produce those symptoms of IBS, and you need to deal with those immediately. So the second thing, aside the foods that are high in FODMAPs, is stress. And then we have things like caffeine and alcohol. They also stimulate the gut and worsen agency. The next will be antibodies in childhood. This is super important. See, emerging research suggests repeated antibodies use may disrupt microbiome development and increase IBS rates later in life. So if you have a child with you and then you are always, bombarding that child with antibodies, it's likely that when they get older, they may develop IBS. And even if you're an adult and you are abusing antibiotics, there's this epidemic of, what we call antibiotic misuse and abuse in our world today. And so if you're abusing antibiotics, the bacteria become overly resistant to antibiotics. You need to take higher dose, and that can also affect your microbiome, okay? Disrupt the balance of your gut microbiome and then cause SIBO and other things, and then leads to IBS. So if you are constantly taking antibiotics, please be mindful. Only take it when it's recommended by your doctor, and do not abuse any antibiotics. Don't do self-medication. That's what I mean. The next one will be cold and fatty food. So these will slow down digestion and can also trigger spasms in sensitive intestines. Now, the opposite of FODMAP will be taking something low. That's what we call the low FODMAP. That has been clinically found to help with IBS symptoms. And so we will say this is called the low FODMAP concept or IBS-friendly food. So things like cooked vegetables, that will include carrots, spinach, zucchini, and then lean protein like the chickens, fish, and egg. Now, because most of the plant foods, trigger IBS symptoms, it is better, or in my best opinion, to consume the animal foods instead, okay? And if you want to consume plant-based food, like I said, it should be cooked. So if you're going to consume carrots, spinach, zucchini, it should be cooked. And also do low sugar foods. An example will be berries, okay? And then even rice and simple starches, soups and stews can even help as well. And now here the point is, cooking foods makes it easier to digest. So if you are eating raw meal, it is very difficult for your body to digest, and that can make the symptoms worse. But if you cook them, at least you don't get as much as side effects or symptoms of IBS rather than when you take them raw. Okay, but most importantly, do more of the carnivore diet than the plant-based foods. Now, how do we deal with IBS naturally after talking about what it is, the categories, the symptoms, the diagnosis, the hidden triggers, and even the causes? Now we want to know how we can deal with irritable bowel syndrome naturally. So here we're going to look at lifestyle fixes that actually work. Now, because IBS is a functional disorder and has 4 categories, there is no universal cure. Okay, there's no universal cure, but IBS is highly manageable, and for many people, dramatically they get improvement in there, and they can even reverse their IBS. So we're going to look at the steps to take to reverse IBS or manage it properly. And this is where you need to take notes immediately. Okay. So the first step will be, to keep what I call a food log or food journal. This is the most important tool above anything else. After identifying the triggers, get a book, a food log, or a food journal, and then track down what you eat. Number one, track down when you eat and when symptoms started. Because as you are doing that, patterns will show up. You'll get to know certain patterns, and that will help you narrow down to the specific foods that is triggering your IBS. So the first fundamental thing is to get a food journal or food log and then track your diet. It is super important. Track what you eat, when you ate and when the symptoms started. You're going to see a pattern, and that will help you identify the triggers of IBS. The second step is to do low FODMAP food, like I said, or strategy. So you start with temporarily eliminating plant-based foods and then do carnivore foods or cooked meals, and then gradually, as you're getting better, you can now introduce some of the plant-based foods. So I said the strategy is not permanent, okay? So temporary elimination followed by reintroduction, and this will help you identify personal triggers. It is very important. Step 3 is to do or eat gut soothing food. So number 1, again, you should eat cooked vegetables instead of raw food. So things like bone broth, absolutely important. Soft root vegetables also good. And then peppermint oil has been clinically found or shown to reduce IBS pain as well. So go for peppermint oil as well. And that is why a meta-analysis published in the Journal of British Medical Journal found peppermint oil significantly improved IBS symptoms compared to placebo. Step number 4 is meal spacing or meal spacing. Okay, this is where most people see real result. So at least eat every 4 to 5 hours. Why is that so, or why is that important? It allows your gut to activate what we call the migrating motor complex. That is your natural cleaning wave. It allows your body to relax and then clean out food from your gut. Okay, so at least eat every 4 to 5 hours. Don't overeat. Don't eat every so often. Don't snack in between. That's what I mean. Okay. And then step number 5, when it's close to, when it's related to number 4, will be mindful eating. That is, slow down when you are eating. Take your time when you are eating. Chew thoroughly. You see, when you are chewing, you mix the food with saliva and some other bacteria, and this helps improve your digestion before they even get to your gut. But if you swallow your foods, you don't help your gut at all. So mindful eating, that is, slow down, don't overeat, slow down when you're eating, and then chew your foods. No matter what the food is, please chew that food. Don't also eat stress, because stress shuts down digestion. And step number 6 will be stress therapy. Remember again, stress or the nervous system is in constant communication with the gut. So if you are stressed out, it's definitely going to affect your gut. So things like deep breathing exercise really works perfect for you, okay? And also walking after a meal or even taking a walk with nature helps calm your mind. And then we have meditation therapy and also better sleep. Sleep is important, okay, for stress management or relief. Because now you see, these things aren't optional wellness extra. They are actually gut treatment. That is deep breathing exercises, meditation, walking, and sleep. Because your gut depends on your nervous system. And when your nervous system is calmed down, it also has positive effect or impact on your gut and can help with your IBS situation. And the last step that I want to talk about would be to support with some natural supplements with evidence. So things like digestive enzyme like pepsin, very good. Peppermint, what we call peppermint oil capsules, magnesium for constipation, absolutely wonderful. But if yours is diarrhea, that is if your type is IBS-C, that is constipation, then you can go for magnesium. But if IBS-D, which is diarrhea, you can't go for magnesium because you're going to worsen your diarrhea. And the things like soluble fiber, example will be the psyllium packs. We have L-glutamine and some targeted probiotics. Not all probiotics will work for you, especially if you have SIBO. If you suffer from SIBO, do not take any probiotic. It's going to make things worse. So, but if you do not have SIBO and then you have low acidity, then you can take obviously probiotics to help with your digestion. And lastly, let's discuss the difference between IBS and then IBD, that is inflammatory bowel disease, and then irritable bowel syndrome, because a lot of people get confused here. Okay, and that will be our last discussion for the day. So this can be, like I said, this can be very confusing for lots of people. That is the difference between irritable bowel syndrome and inflammatory bowel disease. So here is the simple answer. Irritable bowel syndrome again is a functional disorder. So there's no tissue damage if you do a scan. However, with inflammatory bowel disease, it is inflammatory as the name suggests, and there's actual lesion or damage in the gut. So these are the differences, and they normally share the same symptoms, but they are not the same disease. The distinction matters a lot. One is a dysfunctional condition, or one is a functional condition. One is actually a damaged inflammatory condition. Okay, so these are the distinct differences between IBS and inflammatory bowel disease, or IBD. Now we've talked about, so in summary, we've talked about, what IBS is all about, affecting millions of people worldwide, and then we talk about, the diagnosis, where there has to be pain, and then other, in addition to pain, we have changes in stool frequency, changes in stool occurrence as well, and there's no definite lab test to diagnose you of IBS. It is purely based on symptoms and signs. And so we use the what we call the room IIB criteria to determine if you have IBS or not. And then we've talked about, things that also mimic IBS. So things like Crohn's disease and others can also mimic the symptoms of IBS. So never self-diagnose persistent gut pain. Please see your doctor if you are suffering from any of these symptoms or condition. And then we look at the 4 types or categories of IBS. Number 1 will be IBSD, which is dominant of diarrhea dominant, IBS-C, which is constipation dominant, IBS-M, which is a mixture of both constipation and diarrhea, and then IBS-U, that is unclassified type. And then we've talked about the root causes or why IBS happens in the first place. Number 1, we said gut barrier connection. We have visceral hypersensitivity, which is very important. We have gut motility problems, gut microbiome imbalances, SIBO, that is small intestinal bacterial group, and then food sensitivities or food intolerance. And lastly, we talk about post-infection IBS being another root cause of IBS. And then you look at, most importantly, the triggers or the hidden triggers of IBS. We talk about FODMAP being the most impactful negative thing on IBS. And so we say FODMAP stands for, fermented digested carbohydrate. O stand for, oligosaccharides. So things with the grains, the garlic, the onion, the legumes. We talk about the sugars and the disaccharides, the monosaccharides to be other sugars, and the polyols also the carbohydrate and the fiber. So things like garlic, onion, gluten in wheat, beans, legumes, apples, artificial sweeteners, caffeine, spicy foods trigger, all of this, and even certain nuts trigger the symptoms of IBS. And because they stretch your colon and they pull water into your gut and they get fermented and they produce gas, leading to pain, bloating, and diarrhea, or even constipation. And then another trigger will be stress, and stress is most important because I said IBS is one of the clearest examples of the mind affecting. But so once you are stressed, it affects your gut function as well. And then caffeine and alcohol also affects, trigger symptoms of IBS. And then we talk about antibiotics either in childhood or even adulthood as well. And then cold and fatty foods. And so we look at food that you can eat that will have minimal side effect or negative impact on your gut. So things like cooked meals, they mostly do during the carnivore diet will really help as well. Because cooking food makes it easier to digest your food. And then we look at the steps to take if you want to deal with IBS naturally, things that actually work. So we said number 1, keep a logbook or food log to track down what you eat, and also do what we call the low food map strategy, and then go for gas soothing foods, okay, and then meal spacing. At least eat every 4 hours. Don't snack in between meals, okay, so that your body can have enough rest to get rid of whatever is in your system. And then be mindful what you're eating. Eat slowly and then chew thoroughly when you are eating. And then lastly, do manage your stress properly. So things like deep exercise, breathing, meditation, sleep, all of these things help. Including exercise helps you with your mind in calming your nervous system. And then last, I said you can support your gut with certain supplements and food. So things like the pepsin, peppermint oil capsules, magnesium, stable fiber like the psyllium, L-glutamine, probiotics can easily help you with your immunity. But you need to know that IBS is individualized, okay? It depends on the category you have and how you can approach it now. And then now we also talk about, the difference between IBS and IBD. We said one is a functional disorder, one is actually an inflammatory disorder. And so IBS, is very frustrating. It is invisible, it is misunderstood, but it is real. And your symptoms are not in your head. Whatever you experience with IBS is real, okay? It's not an illusion, okay? It's not a mirage, okay? And so, but however, with the right strategy, diet awareness, stress control, that support many people regain control over their lives. But the good news is that it is manageable and reversible in many cases, as so far with my patients who have been able to manage their IBS properly and even reverse it in the future. And so this brings us to the end of our discussion. So if this brings us to the end of the discussion, and that is why it starts with understanding your body. So stop treating just the symptoms and start fixing the root cause, and you will be fine. Now, if this video helped you understand your body better, tap like so it reaches a lot of people silently struggling with IBS. And please comment below what triggers your gut the most, or what symptom you struggle with the most. Subscribe and share this video with someone who needs relief, because nobody should, suffer digestive pain alone, because your gut health journey starts today. I'll see you in the next video. Thanks for watching, and God bless. If you have any questions, please drop them in the comment section below, and I'll be really glad to answer you. Okay, this brings us to the end of our live streaming, and I'm going to go off any time soon. All right, I do really appreciate it, and good morning, good afternoon, good evening, wherever you find yourself. Remember again, your health